on managed security services, because I truly believe that that's what the industry is going to have to go to. When you look at the requirements that are in HIPAA and you look at the requirements that are in high-tech, you look at what's necessary just to do the job correctly from an audit perspective, a log management perspective, and intrusion protection perspective, etc. They can't. Most hospitals today have a security staff that's no more than 3 to 4 people. The average hospital. Larger hospitals will have a larger group than that, but you don't see large security departments. You don't see people dedicated to log management or to IDS or like you have like I had in the federal government, where I had 300 people in a security department, and 30 some odd of those people were focused on nothing but computer security. Right? We don't have that in healthcare. We're not going to have that. It doesn't make sense to. So how are we going to get the job done, get it done correctly, and get it done at a level of confidence that they can be pretty assured that the data is protected, the systems are protected, their business is protected, and they can focus on what they do best, which is providing care to people, and that they can do that at a manageable cost, right? And I think the answer is absolutely managed services. Outsourcing that IDS monitoring, that log management, that firewall management, etc., to folks that actually do that for a living and can do it much more effectively, much more proactively, and at much lower cost than they can do it in-house. If you take just one of those things, like IDS management or intrusion detection, in order for me to manage an intrusion detection system internally in my organization, I have to have 3 to 4 people dedicated to that system to manage it around the clock. Right? And that assumes nobody gets sick and nobody goes on vacation, and everybody knows exactly what they're doing. And I have to have the right people with the right skill sets and the right certifications and the right training to be able to do that. And even when I have that, the problem is that those 4 people, all they're seeing is what's going on in my organization. They don't have the benefit of what's going on across the industry, right? But I have to pay the cost of all 4 of those FTEs, plus the solution, et cetera, et cetera. Whereas if I go to a managed IDS solution, I'm paying a fraction of that cost, because one team at a SOC, at a managed security service provider, can manage up to 50 customers, right? They're much better trained. They have much deeper experience because they're looking at hundreds of clients. They have an industry-wide perspective, so they can provide even better proactive support to me in my environment. And I'm not paying for all 4 of those people, right? A much better solution. And I think that's where we got to go in healthcare if we're going to get it done.
Yeah, and managed security services is not novel on a global scale or at a national level, but in healthcare specifically, is it important to build out that proficiency with a healthcare-specific managed?
No, interestingly enough, it's not. The one aspect of that's different about healthcare, where we're going to have to develop some competency in healthcare, or in those organizations that do it for healthcare, is on the privacy monitoring side, right? Because the one thing that's different about healthcare than you have in a lot of other industries is most industries, when you talk about security monitoring, you're talking about security events within systems, right? Network events. You're not really talking about Joe looking at Mary's record, a privacy issue. Whereas in healthcare, we have this very real privacy issue with respect to patient information and who should have access to it. And we have tools now, thank goodness, that allow us to actually monitor those privacy, do that privacy monitoring. That capability, though, is identical to the network monitoring capability from a log management perspective. It's just you're looking at 2 different things, but you're still looking at events that are created by logs that are created by somebody doing something. What's different is the people doing that kind of monitoring are going to have to develop that competency in those use cases, if you will, around that privacy monitoring side of it, to be able to recognize and know when there's been a violation over here, just like they know on the security event side, right?
Right.
So other than that competency, the process, the skill sets are all the same. This year, for the first time, at DEF CON and at the Black Hat conferences, where the hackers actually congregate and talk about the different exploits that they've come up with, you actually had sessions around hacking healthcare systems. Individuals who were demonstrating how to hack an MRI, how to hack a CT scanner, how to hack a blood monitor or an insulin pump, right? I mean, somehow that's all of a sudden become fair game, and it's pointing out things that we've all known for a long time, which is we've got an issue with medical devices. They're basically insecure. We have an issue with security in healthcare, and unfortunately, what it kind of shines a bright light on is that we have standards that they're not where they need to be with respect to the kind of information that we have and the risk to the individuals involved. Because when you start hacking medical devices, you start hacking things like MRIs and CT scanners and devices that are helping monitor bodily functions on individuals, heart monitors, etc., you've got a patient safety issue, right? It's not just a confidentiality issue anymore. So we do need standards. We do need better standards. We need a standard that is at least on a par with where our technology is and where it's going with respect to our enterprises and this connected world that we're trying to create with healthcare today. 5 years ago, 10 years ago, when health information was in a nice folder with all kinds of colored tape on it, you had to back a pickup truck up there, you had to break into the building, you had to steal those records, and it took you forever to figure out what was in there and do something with it. Today, all I have to do is find a network that has a USB port that's active and no network access controls on there and no DLP or whatever to stop me, and download 10,000 records, right? Or take 20,000 records and put them on a public website. Or take 4.9 million records and put them on unencrypted tapes and put them in the back of a car and park them downtown, right? The risks are much different today. The standards need to be on a par with where the risk is and where the technology is, and that's not where we are. If you asked me, are there going to still be breaches even if we do a good job with security, the answer is absolutely yes. There will still be breaches. There will still be mistakes made. There will still be situations occur where the threat is out ahead of us to the point where something happens that is not avoidable. The problem with that mentality is it says, I just give up. I don't even try to stop the things that are avoidable. I don't try to do the best job I can to eliminate as many of those risks or as many of those events as I possibly can. I mean, I said this at a conference not too long ago when somebody was talking about the fact that we've had 330 major breaches. You know, over 500 records were involved, and we've had, you're working on now 40 or 50,000 breaches total when you start adding in all the little ones, right? And I made the comment, if I'd had anywhere close to that many breaches as the director of security at the agency, me and the director would have been sharing a cell somewhere, right? I mean, it was just not acceptable. It was not acceptable to say that we're going to have breaches, ergo all we have to do is be able to react to them. You know, the idea is we're going to try to stop the breaches and keep those from happening, knowing full well that even when we do our best, there's probably still going to be something that happens. But then when that happens, everybody recognizes that you were doing your best, and it was unavoidable. Right? So the problem I have with that mentality is it says I can give up. It says I can spend less than 3% on security because I'll just go buy cyber insurance and be ready to pay the bill when I have to notify people, as opposed to saying, you know what, I don't want to have to notify anybody. I should be trying hard not to have to notify anybody.
Yeah, and in terms of, from a patient's perspective, that same mentality of, I give up, wouldn't typically sit right with a patient in putting their faith in an organization that's there to protect them.
Yeah, I think if you lined 100 patients up and had them answer that question, you'd probably get 99 of them at least that would say, that's not acceptable to me. I would expect, patients expect, not just patients, consumers, period, expect that when they give anyone, whether it's a lawyer, whether it's a physician, whether it's a bank, whether it's a company, a retailer, whatever, when you give them your personal information, whether it's a credit card number, whether it's other financial information, whether it's your personal information, whether it's your health information, your expectation is that you're giving that to them in confidence and that they're going to protect it. That you haven't somehow just all of a sudden given that information to away and it's going to be out there in the public domain, right? And when they've done surveys, privacy surveys, and they've asked people, how much confidence do you have in the relationship between you and your physician? There's been a high mark. Over 90% say, I trust my physician. When you ask them that same question about large organizations, and in particular the government, that mark is down around 20 to 30%. They don't trust it. They don't trust large organizations. So now how does that play when you start talking about HIEs, ACOs, et cetera, right? Where all of a sudden the patient says, oh, my data is not just with my doctor anymore. It's somewhere, but it's out. Everybody can have access to it. Okay? And I think, to be honest with you, I think that's eventually what's going to change the behavior in this industry, just like it has in other industries, is eventually the consumer is going to say enough is enough. And I think that's what we're seeing when we see the state laws that we're seeing coming out, the state legislation that we're seeing. That's a direct result of consumer complaints to their representatives. I think when we look at the class action suits that we're beginning to see, class action suit against TRICARE, the class action suit against Stanford, the class action suits that are pending against the outfits up in Oregon, those suits are a direct reaction to those breaches. And I think it's a reflection of somebody on the consumer side saying, I don't trust that the federal government's going to do anything about this. There's been 300 and some odd breaches, and 3 people have received a fine. Why would I ever expect that that's going to curb any behavior or change any behavior?
Yeah, and there are others that argue that data should be liquid, and data liquidity in healthcare would lead to the advancement of many more medical advancements than we're currently seeing today. Do you believe that benefit outweighs the risk?
I think there has to. I think that there is something to that argument, but I think there has to be balance. And I'm not convinced that we're doing enough to provide adequate protection yet to the point where we're affecting the ability of that data to be liquid, right? So in other words, I think there is a lot more we could do that would actually facilitate that liquidity in a much more trusted environment if we actually embraced it as opposed to kept blaming security for it not being liquid enough.